Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Busy day in Rhode Island, a lot of updates across the board on news, sports, and Michael Rose on art. But I've got Dr. Phil Chan. He's sort of the guru in Rhode Island. We've known him on across the board on so many different issues. Dr. Chan, thanks so much for joining us.
Thank you for having me.
So I wanted to get your input. You've been, a person that I think the public trusts, and certainly we trust as journalists for smart information. MPox is beginning to sort of make some headlines globally. An outbreak in Africa, touching base in Western Europe, and a couple of episodes here in the US. Talk about MPox and talk about this new strain called Clade 1.
Yeah, so MPox, I think as a lot of people know, we did see an initial outbreak back in 2022, and that was due to Clade 2 of the MPox strain. So Clade 2 has a much less and has had a much less mortality and morbidity rate, and we largely saw that pretty much die out here in the US and a lot of Western countries because we aggressively vaccinated and performed other infection control measures. The worrisome thing now is that we're seeing a new strain of MPox emerge in Central and Eastern Africa, in the Democratic Republic of Congo and surrounding countries. And this is the Clade 1 strain of MPox. And the reason why this is a little bit more concerning is because historically Clade 1 has had much higher morbidity and mortality rates. Mortality rates meaning folks that potentially die from this has been upwards of 10%. So we are a little bit more concerned about this, and we are certainly watching it closer.
Okay, so it's traveled. Sweden has a little bit of an outbreak, a pop-up in Tennessee with some cases, and then in California in the San Francisco area. The description of the symptoms are very much like COVID, almost all of them: exhaustion, headache, sore throat, et cetera, except for one, which is the rash, and the rash is very distinct. Talk a little bit about how people should treat it. You know, listen, everybody's global now. People are traveling across the world. Folks are coming here and there and everywhere. We're far away from closing down travel. Talk a little bit about what people should look for, especially if they've been traveling.
So at this point, the risk to the general public is low. So there's no reason in general for folks to worry. However, we do want people to be aware about it. And certainly folks that are traveling to Central or Eastern Africa, to people that are interacting with folks that may have traveled to Central or Eastern Africa, folks should be aware of the symptoms. And I think, as you mentioned, some of these are very nonspecific. There's things like fevers, chills, not feeling well, muscle aches. But the one sort of key feature is this rash. And the rash is very specific. People often get these ulcers or blisters. Typically, they're fluid-filled. And the one key thing, and the one key complication of MPox, and what people really suffer from, is the pain. This rash is really painful. And in fact, sometimes people have to be admitted to the hospital just for pain control because it's so bad.
Got it. We've got you here. Obviously, we've talked to you on air and off air 8 billion times on COVID. There's a little bit of a spike here in Rhode Island right now. You hear it anecdotally every day, all day, and you also see it in the statistics. Talk a little bit about where COVID is in Rhode Island right now and what people should do.
So we are seeing an uptick of COVID cases here in Rhode Island, frankly across the US. The good news is, as people have become more immune to it, both through vaccination and prior infection, we are seeing COVID be less severe. So we're not seeing quite as many hospitalizations. We're still seeing some, and we're not seeing as many deaths either, although we are still seeing some. So that's good news. So at this point, as COVID has become more endemic, reminding folks just to take basic precautions, right? Wash your hands when you get home. If you're sick, don't go to school or work. Make sure to stay updated on your COVID vaccines, et cetera, et cetera. So we're getting used to this. We are anticipating that there will be perhaps another peak in the winter. So really just encouraging people to stay up to date on their COVID vaccines if they aren't.
Are we seeing the same dynamics? We first reported, I believe, on Saturday about the Department of Health taking disciplinary action against a nursing home administrator who had uh, ordered a COVID-infected, non-licensed cook to come back and to serve, and then there was an outbreak at that nursing home at Pawtucket Falls, and there's 13 reported cases linked to this episode. Are those, as we saw in the COVID outbreak in 2020, where we saw people being returned back to nursing homes in massive numbers of infection and a significant number of deaths in the hundreds, are those folks who are infected at that nursing home, are they at risk at the same type of mortality that we saw sort of in that 2021?
So the good news again is even in folks that are a little bit older, potentially immunocompromised, we're not seeing the same levels of morbidity or mortality. So people are definitely not dying at the same rates. This is largely due to great access to vaccines and also some degree of prior immunity due to natural infection as well. I think when we think about COVID now, we are still really concerned about folks that continue to be immunocompromised or older. And that's why I think there's still concern in nursing homes, in assisted living facilities. We are still seeing outbreaks in those settings, and we are still seeing people die, especially folks that are older and immunocompromised. And so when we see outbreaks in those settings, it is prudent to take more aggressive precautions, again, because people are still dying in some of these settings.
So historically for each year in either the last week of October, the first week in November, we got our booster shot for COVID and our flu shot. We do it the same day because we know we're going to feel miserable, and so why not get both, minimize the amount of miserableness, and we don't know who to blame, which shot actually made us miserable. So is that the schedule, sort of once a year you get your booster shot for COVID just like you get your booster shot for the flu?
I think it's going to be. Part of this is still evolving 4 years later, but as of this moment, it is looking like there's probably going to be at least an annual booster, as there has been for flu, and it looks like for COVID, is that this will probably develop into a routine thing.
And then as you look back over the 4 years, I was just looking back at all our reporting, hundreds and hundreds of articles, literally, 500-600 GoLocal live interviews between Dr. Fine, yourself, people in Europe, across the board, experts at Brown. What's the lesson, and are we in any better sort of shape to deal with whatever the next virus is, the next public health emergency is?
So the answer is yes and no. I think that many of us, baptism by fire. A lot of us have gone through this, have gained a lot of good experience. We've learned about a lot of the challenges. Obviously, we've talked about so many of them, from testing to masking to PPE. And I think we are better prepared based on these lessons. And we have, in general, in the public health and the clinical community, we've learned a lot of lessons. I guess there are still some continuing challenges. I think folk have become fatigued by a lot of public health guidance and recommendations, and of course, no one wants to hear mandates anymore, and I totally understand that. But I think as these things emerge, we just have to keep an open mind, and especially as we think about our most vulnerable populations. And I keep coming back to that for COVID. I come back to that as I think about avian influenza. There's been a lot about that in the news, H5N1. It's just thinking about systems to monitor sort of these emerging potential pandemics, and then thinking about how we respond early before it becomes a global pandemic like COVID. And if it does, thinking about how to protect those folks and populations that are most vulnerable and what we can do. So lots of lessons learned. I think that there's a lot of things that we can continue to do to move forward, to improve upon, but I remain optimistic as always.
Last question. Any indications as to what the flu season's going to look like? We've sort of forgotten the flu over the past few years, but if we go back 6, 7, 8 years ago, we've had some brutal flu seasons with a significant number of deaths, and the flu's a little different from COVID. Flu historically, depending on the strain, has hit, of course, the older and those with immunity issues, but also children have suffered greatly during significant flu outbreaks. is there any sort of World Health Organization, CDC prediction on what this flu season will look like?
Yeah, great question. I haven't seen those predictions yet. I think that most of public health right now is very wary and watching closely this developing situation with avian influenza, so H5N1. Some of you may have seen this in the news, but basically these flocks of birds and poultry and dairy farms, cows, are being infected with this highly pathogenic strain of avian influenza. So it's influenza subtype A. It's been labeled by the CDC and others that this has moderate potential, potentially, to be transmissible among humans. There's been some sporadic cases, and I think the big concern is that we'll see one of these more pathogenic strains of the flu become more widespread in humans. And that's been everyone's concern right now. We're hoping that it's a, quote, typical flu year, but I think that it's been, the exception has been this emergence of H5N1 in all these animal species that has the potential to be a very bad flu, potentially even pandemic if it gets to that point.
Dr. Phil Chan, I always appreciate it. Appreciate you taking the time, your expertise. For everybody else, stay tuned. A lot going on. As I said, an analysis of some of the problems over the Department of Corrections, 2 significant arrests, and the director over there being fined by the Ethics Commission. In addition, Kevin Stakeham's got a great piece. I thought I knew everything about basketball in this region, but he's got a great piece about an AAU program that's really emerging here in southern New England. And Michael Rose has a great piece about a superstar emerging artist. Take a look at her work as well. So take a look at that breath, and we'll have updates throughout the day. Thanks, everybody. Stay safe and enjoy tremendous end of the season weather.